Imagine a woman now in a rural community that does not have access to internet, does not even know how to use some of these things. How do you think they can access family planning with ease and with zero internet and low-based technology?
We have an emergency. Apologies, I need to break. So we just want to confirm if the owner of this car is here, MVS 484HH. MVS 484HH GMC. And then the car is on fire. Fire. Anyone? MVS 484HH. They just want to be sure it's not in this room. Okay, so you have extra 2 minutes.
Thank you. So now in a rural community where they don't have access to internet, that is why we design MedBots in such a way that with USSD code, you can access family planning information, sensitization awareness, and also enroll and receive a text message prompting you to go to the nearest primary healthcare center in your village and take on the procedure. How does this work? Imagine that woman in the community who died while giving birth to the 7 children. Other women can as well pick their phone, dial the same USSD code, and listen to the procedure together, even without internet. And let's assume one of them is not, maybe some of them does not even have a USSD phone, but they can access the information at any time they want it. Not that they listen to it on the radio and they'll be waiting for the advert to come back again. They can actually listen and get the sensitization information on their own. Please, can I have my slides up? So what is the key features in MedBot Family Doctor? One of it is the USSD approach in such a way that when you dial 080 MedBot Family Planning, you can listen to an assistant who will walk you through the procedures of family planning. And also you can dial *371, which will actually now walk you through some of the methods, the ones suitable to you and how you want to opt in. And if you press 1 to opt in, you receive an instant message linking you to primary healthcare center around you to follow up with your family planning steps. Another one is the conversational chatbot for busy female professionals, someone that is in the bank, someone that works in the bank and does not have even time at hand to go to hospital or nearby private healthcare facility to uptake this. You can get the consultation together with even your partner using a chatbot. And lastly is the provision of the primary healthcare center, the NHIS and HMO. We understand that 40% of people uptaking family planning actually uses private sectors, and some of them who works in corporate organizations as HMO providers. So you can actually now link this up and use it to take up your family planning services. So what is our impact? So our impact is to reduce maternal deaths, because like the case of the woman that I shared earlier on, she doesn't know family planning exists. If she had known, they would have uptaken it rather than having to pass away while giving birth to the 7 children. What happens to the fate of the 6 she already has? Another impact is that we want to be able to remove logistical hurdles. We understand some cultural barriers in such a way that your wife cannot go out or as such. I've had a case whereby a male doctor actually took delivery for a woman and the husband had to put her away. But for these cases, we can actually send in the healthcare providers to you, and they can do the implant, give the injection, or any method that suits you without having to go to the facility. Other impact is to make sure that we target like 50,000 female in rural communities in Osun State to ensure that 9 out of 10 of them is actually using family planning. And the last one is to prevent unwanted pregnancies and unplanned babies. So what is our revenue model? Because we understand that these have to be sustainable, and we'll be charging, for instance, 3 Naira per SMS in a month, which is 90 Naira, and 10 Naira will be left from the charge for our profit, meaning that we'll be charging 100 Naira per month for the use of this solution, because we understand our targeted audience, they are not the very, very rich class. So this is our user persona. Amina is the woman that I mentioned earlier, that she is planning to marry another wife for her husband, and Elizabeth is the busy professional who works in the bank. So our user journey now starts with awareness through radio sensitization, since most of them are on small USSD devices, until we go on to make sure that they have they consider the use of family planning, acquisition, service, and also loyalty. We can also track what they feel about the service and the ease of using our solution. So the challenge is that people believe that when you use contraception, you might be promiscuous. We also need to work with maybe religious group and stakeholders in the community to let them understand that no, this is not about being promiscuous. It is about saving a life, saving the mother and the children. And also we'll be working with wide stakeholders. But we believe that if we have government as one of our stakeholders, I think every other non-state actors can fall in line, because government is actually the biggest partnership you can actually secure. And lastly is that in 2019, 20 to 30 million Nigerians are not even using any phone at all. So this is where the pre-recorded approach comes in, whereby somebody in the community that has a phone can dial the code, while the other community friends can actually listen to the procedures of family planning. So in conclusion, I'll just touch one because of our time. Undecided individuals. So we want to offer unbiased consultation. Like I mentioned earlier, men too should also consider family planning, but let's leave that for our long-term goal, where we see men also taking up vasectomy and other things, so that we won't put all the responsibility on the shoulders of the women alone. So this is our team. I'm a data scientist, we have a pharmacist, and we have a product designer and an health journalist here. Thank you.
Thank you very much. You can drop that there. I'm trying to understand the concept of one man, two wives. Thank you very much for bringing that up. And I think I also want to commend your work and what you intend to achieve, especially the introduction of USSD. Which enables those who could not, something that is not internet dependent in that regard. And I've helped you to memorize the code, *371#. So we can start using it from now, maybe as soon as we get it launched. Well done for the great job. All right, that brings us to the end of the presentation for the hackathon finalists. Can we put our hands together to celebrate all of them? So I don't want to ask you, who do you think should be the winner? You have interacted, you have listened to them, but don't worry, that has been done already. And we're going to have the results announced at this event. So going to the second phase of these award sections that led us to this meeting, looking at the innovations around technology, creativity, and others. I'd like to lead us now into a panel discussion. And this is like the last major part of this event. So please stay tuned. We will be rounding up very soon. So to lead us in the conversation for the next meeting, I'd like to receive to the microphone the Executive Director of HESI, who will be moderating this panelist section. Distinguished ladies and gentlemen, please let's make welcome Rhoda Robinson. I want to believe she's in the hall. Let's put it up for her. Bigger, 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 make it warm. Thank you so very much, Madam Rhoda, for all you do. Please, you have the floor. I've been told that since you know the innovators better, it's better I should go ahead. Okay. So the next set of innovators, please you can have a seat. Thank you very much. The next set of innovators that will be discussing and will listen to their innovations and their ideas will be moderated by Ms. Rhoda. Then we will now wrap it up with the presentation of awards. That brings us to the end of the event for today. Just a rundown. So let's make welcome. I've been struggling to pronounce this. Is it Kia Kia or Kia Kia? Either way, it's Care Health. Okay, so let's make welcome Dr. Abosede Lewu, who will be speaking on behalf of Care Health. And also, yeah, thank you very much for giving it up for her. You can see their branded shirts already. Also, on behalf of E-Likita, that's a very nice one. Also, let's make welcome Muhammad Sadiq. A round of applause for Muhammad Sadiq in the house. Is he coming up? Oh, great. Please make your way to the podium. And last but definitely not the least, on behalf of Packers Mobile Clinic, ladies and gentlemen, please make welcome Dr. Charles Ume. Dr. Charles is in the house. A round of applause for him, please. Thank you very much. So you have the floor. The mics are beside you. And now it's my duty to hand over the microphone to Rhoda. Over to you.
Thank you very much. Good afternoon, everyone. Thank you all for being here today. And thank you for the support you've shown for innovations in family planning. So we'll quickly get into this. We have here one of the three innovations from the Family Planning Innovation Call that was sent out a couple of months ago. And through some rigorous selection and reviews, we are presenting these three innovations, and their leaders and their innovators basically would be talking us through their ideas and the impact that we hope to see in family planning through these innovations. So to start off, I'll give 1 minute to each panelist to give us an overview of their innovation. And I will start with Dr. Abosede. So please tell us a little bit about Kiakia Health in 1 minute.
Hello? Okay. Hi, everyone. It's a pleasure to be here. So I'm Dr. Abosede Lewo. I'm a gynecologist. And Kiakia Health is a tech-based platform that provides instant access to sexual and reproductive health services. So Kiakia Health started as one of the ways to reduce maternal mortality, which is the one we rarely talk about, which is the unsafe abortion that disproportionately affects younger ladies and unmarried women. So we find that over time, all the barriers that have been mentioned by all the Akaton finalists are the things that they face. So we came up with how can these women anonymously ask questions? And that was how Kiakia Health sort of developed. So people can stay in the comfort of their homes and simply ask about contraceptives, and they can access it, they can order for whatever services they need. Now, Kiakia Health took it a step further beyond answering their questions. How can they access care? If we set up a center and say this is the center for contraceptive, after a while, everybody knows that when people go into these spaces, that's what they're going there to access. So the stigma continues. So we came up with the concept of build clinics, where we partner with value-aligned, non-sort of signaling centers. So some of our partners are dermatologists, dental centers, just about regular places you can go into and nobody cares what you're going in there to do. While our skilled health professionals who know how to deliver user-friendly, non-judgmental services are able to provide those in-person needs that they need. Over time, we're able to also realize that this will also be a vehicle for talking to them about other SRH. So a young 19 or 18-year-old calls you, how do I use contraceptive? And then you say, okay, this is how you can use it. Have you thought about how you can screen for STIs? Do you know your STI status? Have you ever checked yourself for HIV, hepatitis? And this conversation leads to that. Some of them now requesting for self-testing kits. How can they test along with their partners? So basically, that's how we operate. People can access us. We have very youth-friendly team members. And then we use the concept of veiled clinic to deliver, to navigate the stigma that young women usually experience when they want to access care. Thank you very much.
Thank you so much. A round of applause for Dr. Abosede. So we move on to Mohammed. Please tell us a bit about e-Likita.
Hello. Okay. Hello, everyone. Good day. Thanks for the opportunity to be here for you. My name is Mubarak Sadiq. I'm representing the Child Trust Fund, which developed e-Likita, which is a digital platform that is targeted at improving the skills of health workers in remote rural areas, of which delivering contraceptives, education, and care forms part of it. So what we do is we get health workers in those areas, we train them, we give them material that guides them in delivering those the education, and also train them on how to capture the demographic and social data. So eLikita was sponsored by Grand Challenges Canada under the program called Stars in Global Health. So it has impacted seriously because it has improved the number of users of contraceptive in that area. It is a very remote area, and there have been these misconceptions about family planning. So what we do is we get people from those areas, train them, and give them this tool to go into the villages and educate them, tell them what options they have and where they can access them easily. Yeah, so that's the summary of eLikita. Thank you very much.
Thank you very much, Mubarak. So I'll move on to Dr. Charles Ome. Could you tell us more about Parker's mobile clinic?
Good day, everyone. My name is Dr. Charles Ome, and I'm a public health physician. Our organization is on the digital health platform.
Sorry, could you speak into your mic?
Hello, I don't know if you can hear me now. Can you hear me?
Mubarak, switch up yours. Thank you.
Hello, I don't know if you can hear me well now. Okay. So my name is Dr. Charles Ome, a public health physician, and what our organization is that we use a community outreach-based model and a partnership-based model to strengthen access to family planning services for people that live in remote areas. Basically, we are we aim to serve people that ordinarily don't have access to its family planning services. How we operate that we try to explore partnerships with international organizations, and also we Hello, everyone. Good morning. I think I have to start afresh, right? Okay. So my name is Dr. Charles Ome, and I am a public health physician. My organization was founded in the year 2019. And how we basically operate is that we use a partnership and a community outreach-based model to improve access to family planning services for women that live in remote and hard-to-reach areas. So basically how we operate is that we identify partnership models with international organizations that want to deliver specific family planning services to the women in Southeast Nigeria. Then we also work with the state governments to identify issues or challenges with family planning in specific communities so that we can design interventions that target these problems. Also, we have the home-based healthcare service model where we work with companies to be able to get the women that work in the organizations to be able to request for our services, which we deliver through a paid home healthcare services, whereby women that can afford to pay for home healthcare services can pay for family planning services that will be delivered at the comfort of their homes. Thank you.
Lead away. Okay, good. Yes, I can use this one. Okay, thank you very much. So while you still have the mic, could you tell us in what ways your approach of integrating family planning services into the home-based healthcare model has enhanced the convenience and privacy of individuals in remote and underserved areas?
Okay, so first, just like I said, we have the home-based healthcare services for those that can afford to pay for family planning services at the comfort of their homes. Then we have the community outreach services where we work with the government and with donors to deliver specific free family planning services to communities. And also part of what we do as part of that is that we also train community health workers, and we distribute the popular family planning handbook to community health workers. We discovered that this handbook exists, but most people don't have access to the handbook because they don't even know that it's there. So we request this handbook from WHO, and then we distribute it to the community health workers working with the government. So that is the first model of our intervention. The second model is that we identify people that can pay for the services, okay? They can book for the services through our website or through our WhatsApp platform. So they can book for family planning service delivery at the comfort of their homes, basically the long-acting family planning methods. So these services have helped women that have issues with privacy on family planning to be able to access this service comfortably, because we actually know that we still live in a society where people still have some challenges with accessing family planning comfortably due to myths, misconceptions, religious factors, and other cultural barriers that interfere with them going to the hospital or going to community outreaches to access these services. Thank you.
Thank you very much, Dr. Charles. I'll move to Mubarak. Could you please tell us what measures you have in place to ensure the sustainability of the e-Lekita impact in the long term, growing from your success from 200 to 600 to what you have right now and its users?
Okay, thank you very much. So as I've said earlier, DHE Health Trust Fund organization. So we don't charge for these services. What we do is we seek collaboration with partners that are doing similar work as us, and also we collaborate with the government to secure those commodities that is required. Then we give them to our community workers. We send them out there to deliver. And okay, so because we are a grassroots organization, we normally would use a bottom-up approach. So what we do is we get people that are from that community so that those people will not find it, they will freely interact with them, have open conversation and ask questions comfortably, and they are assured that there is confidentiality and all. So those concerns are addressed. So I think this gave them a safe space to kind of approach us and access the services that we render to them. So also what we observed is there is a high demand because within the project entirely is a year program, and then you can see how much we've moved in a year. So a major concern was the confidentiality issue, but because we find a way of kind of reducing it, I think it's geared up the entire process. Yeah. Thank you very much.
Okay, thank you very much, Mubarak. So I have a question for you, Dr. Abosede. How has the virtual interface contributed to making family planning and sexual reproductive health services accessible for young women?
So thank you very much. So Kiakia Health operates what we call the freemium model. So it's free to register. So the fact that we're on all those virtual platforms, people can come in from Instagram, they can come in from Twitter, they can go to the web app, they can call in to register, makes it free. So, I mean, even if the girl is not, or the lady is not earning income, she can register. Another way that it makes it easy is that if you've been to the hospital process, there's a wait time and then there's a registration process where you have to interface. They're asking you what's your name, they're entering all of that. For a young person that is already uncomfortable navigating, finding access to contraceptive, the fact that they can sit down and do all that on their own actually increases the uptake and the rate at which they take it. So the virtual, apart from addressing the stigma, even the process of accessing healthcare becomes easier for them. And these are platforms that a lot of them are already on anyways, so they can just easily register and ask for the care that they need. And for those that don't want to type in, you can actually call in, you can send a WhatsApp. Like you can use every form of anonymous ways you want to without having to see the face of the person that is registering you or to ask your questions. So that has really helped. And a lot of girls forward it to their friends can register because we sort of encourage that. And that increases the uptake as well.
Thank you very much. Before we go to the final rounds of questions, we just wanted to ask the audience if anyone has any questions for the panelists. Just signify. So, comments, questions? Anyone?
Okay, so we have,
One person?
it's big challenging.
Okay.
Okay. What do we have?
Good afternoon. Good afternoon. My name is Joseph Ojonelta. I'd like to ask, in all of this, what is the role the men are playing to bring this to fore? Now, I have gone through this, and I've also gone through this. I think it's just one of them, the innovators, that talked about, the Family Connect. That's the only one that talked about bringing men and women to this. Where is the role of men in the whole of this discourse? I checked around this hall. I didn't see our religious leaders in this hall. We might think it is not important, but this is one of the main barriers to family planning. What are we doing about our religious and cultural understanding about family planning? Because in your innovations, I didn't hear anything that talks about where the men will come in, how we bridge the religious and cultural understanding. Thank you. This question is for all of you.
Okay.
So we can answer in a row. Okay.
Okay. So thank you very much for bringing in the question about the role of men and the role of religious leaders in innovation. Now, one of the biggest things about innovation is when there's a problem that has multiple causes, most innovation targets the one that they can. One of the things I say about religious religion is a value, is a core value to people. And when you challenge it, sometimes it resists the idea that you're trying to send to them. Most of these innovations you can see is to the end user. This is someone that already has these religious convictions themselves, but this is a need that they have and they cannot navigate it. There are advocacies, there are innovations, like you said, that target religious leaders to talk to them about the role for contraceptive. But then this is you now convincing a religious leader to sort of promote one, if he's in an unmarried setting, are you now saying you're advocating that they should start talking about contraceptive in a married setting? And for religions that believe that you shouldn't control birth size, that children are the will of God. So are you exactly tackling their core values? And then for men, there are those that address it. But if you remember that the contraceptive itself, when the complications come, it is borne by the young women. When we are counting the number of people that have had unsafe abortion and maternal mortality, it is the women that are counted, not the men that impregnated them. So there will be a solution that addresses the barrier that comes to men that are part of family planning solution. There will be those that address religious convictions and cultural norms. But this particular innovation is to the end user who does not, if she does not have contraceptive access, can have STIs, can get pregnant, can have unsafe abortion, and can die from that. So there are other innovations. There's no one-size-fits-all approach. This is just a part of the problem we are trying to solve. So that would be my response to the question. Thank you very much.
So we've not actually approached it in the religious aspect, but we've approached it culturally. What we do normally is because they are very remote to rural areas, like, access to those areas is even very, very difficult. So there are those areas whereby if the rural head says stuff, they take it serious and, they kind of listen to them very well. So what we do is when we arrive at those places, we first pay a courtesy visit to the head of that village. So we tell them why we're there and we kind of let them understand the importance of doing that. So people like that, if they speak to the community, they find it easy to comprehend and cooperate. And okay, the role of men. So when delivering the training, we kind of tell the health workers how they should advise the women on how they should approach their husbands, because in most cases the husband will be like, okay, they are not taking this, they just want to do their traditional, the way it has been traditionally. So I think one of the things we tell them is that, okay, maybe you can inform your husbands about the non-contraceptive benefits of family planning, how it can impact their individual economies. So they can kind of change their perspective and arrive at where they want. So that's the approach we've done so far.
Thank you very much, Mubarak. Charles?
I wanted to mention that men have two options in family planning. The first one is condom, and the second one is the permanent method called vasectomy. In vasectomy, the man's tube, there's a tube called the Dotus difference that transports sperm from the site of production to the site of the release. So that tube is tied, and it's a permanent method of contraception. And we have doctors in Nigeria that can do that vasectomy. But part of the challenges that we have is that most men don't agree to that method. But fortunately, we have been having some calls for more men engagement in family planning. And we actually have organizations like World Vasectomy Day that is trying to promote vasectomy worldwide. So we have partnered with them, okay, and also with the Federal Ministry of Health to design an intervention on vasectomy, which is scheduled to start by next year. So we believe that through that intervention, we'll be able to educate men better on vasectomy. And we can also be able to increase the number of doctors that are trained on vasectomy, and also to increase the number of centers where people can be able to get access to vasectomy too. Thank you.
Thank you very much. So as we round up, if there are no further questions, we'll take the last question, which is for everyone. Now, how do you plan to scale your innovative approach to reach even more individuals in future? Yes.
So for us, scaling up we have a lot of work to do with branding and marketing. And what we're doing in Q1 next year is we've had partner clinics, like I said, which we call veiled clinics. We're now trying to set them up in tertiary institutions, and also to have mobile stops in places where you can find youth. So, there's something people call Dirty December. Like in December, there's a lot of events going on. So imagine if we had like a booth here that somebody could come in, make inquiries about contraceptive, or you could even use the barcode to scan and then access other SRH. We're also planning to do that alongside, even at NYSC camps, because youths do go in there, in and out, as well as tertiary institutions. We're also planning to leverage on a lot of social media influencers, because we know that for young people, that's another place that you can sort of communicate effectively with them, and then these things become normal to them. We also have the idea of you getting points for referral as well. You get discounts for the services that are paid for by referring other people to us. And then, of course, we have added services. So we have other, like, all of us are healthcare professionals. We have people that are coming to treat maybe pelvic inflammatory disease. They want to do health checks. These are other ways that we can generate the revenue, sort of market ourselves as this one-stop place you can get quality SRH, but it's mostly marketing, branding, making ourselves physically available where young people sort of come together, either through events or through institutions. So that's the next phase for us in the next couple of months as well. Thank you.
Thank you very much, Obaseki. Mubarak?
So how we intend to scale up is we're engaging the state government to kind of facilitate adoption of e-Likita into the PHCs. Currently, we're trying to cover, because I said earlier that we are doing bottom-up approach, so we're trying to cover that local government and then eventually move to state level, and then beyond that. That's our scale-up plan.
Thank you very much. Charles?
Okay, so for us, how we plan to scale and how we are already scaling is through partnerships. We currently have partnership with about 4 international organizations now. We are partnering with Project Last Mile, Family Empowerment Media, and also we are partnering with UNDP for a health intervention that targets people in flood-affected areas of Anambra State. So through that partnership, we are also improving their access to family planning. So we believe that the more partners that we can get, the more the number of people that we can be able to impact positively with our services. And also we aim to also try to seek more funding through other means, including private organizations that have interest in promoting family planning as part of their corporate and social responsibility. Thank you.
Thank you very much. And thank you to all our panelists for sharing their ideas and the work that they do. We have come to the end of this panel discussion. We do hope that this has inspired those of us in the room to see more into what family planning can be, interventions in family planning, and how we can use existing developments and innovation in the space of tech to improve our reach and the impact of our work. Thank you very much.
I believe we can do better to this great set of panelists. Or maybe I tried to look through the room and I can see more than 50%, possibly less than 30. Yeah, more than 50% of those in this room are less than 30 years. By facial look. Maybe some of us are not in the family planning discussion stage yet, but it doesn't matter. There are different areas of our targets. And I think I like the focus of the conversation with respect to a number of it. Can we have our podium back? We are going into ceremonies now. Who is helping us with our podium? I mean, is it rostrum now? Okay, this is rostrum. This is podium. Okay, so let's get the rostrum back. Thank you. So I like the conversation and the way we were able to interact. And thank you very much, sir, for lending your voice to mine about the role of men in all of these discussion. But the bias is always there. Even in prayer houses, in prayer centers, it is always about women looking for the fruit of the womb. I've never heard about men looking for, what will men be looking for? Eh? So it's always about the woman, and we can understand because they bear the brunt in a lot of these, especially when there are complications as a result of unwanted pregnancy and all that. Again, it's important to highlight some of the key points that we have brought out in this meeting as we begin to wrap up so that we take it home. There is no one solution that fits for all problems or all factors identified. And it's always important to have what we call audience segmentation. So each of the innovation or the intervention have specific audience they are targeting. And one of the things I also want us to look at going forward, a lot of these discussion now centers around technology. We now need to look at those target audience who are not technologically conscious for now. The guys in the rural area and all that who may not, even though people believe that now have access to mobile phones, but in case we still have those who don't, we also need to start looking at discussions around them. But one thing that came out striking for me, I keep having issues around stigmatization, privacy, to seek family planning options. And I begin to wonder, maybe because I'm not a woman, but I would have loved to know, what is the problem? What is the challenge that will be associated, that will bring in stigmatization because I want to seek family planning option? I don't know what our experience have been in this regard. Where is stigmatization in me seeking family planning option? Or why is it difficult for women? Maybe from all your experiences, those who have been in the field, are there feedback you got from women as reasons, or maybe they feel that they stigmatize against them when they go to seek family planning options? Is there anyone with such an experience in the room? Okay, you don't want to share it too. Yes, sir. They are promiscuous. Aha. Yes, educated fairly. Yeah. Aha, okay. Okay, so from that angle of if a wife is telling the husband that the husband needs to use condom for such purposes, then the man starts thinking, is it because you have been having extramaritals that you think you are not safe or I'm not safe and all that? Or that is even indicting the man. Maybe the man is no longer safe in that regard. But I'd like to say this as we begin to wrap up. When you say what's the role men can play, I also think one of these men can do, maybe on a lighter note, is when the woman says, I'm not safe, leave her alone. Is it possible? You disagree? If somebody says, I'm not safe, okay, we have the option of condom, but you know, there are other, okay, let's get your view. It's still discussion section, although we don't have the mic to move around. Okay. Okay. Even this, yeah, I agree with you. Mm-hmm. In family planning options generally. You are saying a lot of things that need to go into the mic.
Okay, so I said at large, if you use unsafe or safe period, we have millions of babies that are here, even for mothers that are here. We know those the babies that were conceived during so-called safe period. So that's not a good approach. But I was saying that in terms of the question he asked was, in these innovations, what is the role of male? But generally in family planning, the word family planning itself to a young person signals that it is for people that are in family setup, meaning married people. Now, from even the data points we have here, the unmet need is ×4 among the unmarried people. So when you ask what is the role of men, what I usually say is, what is the role of a single man, not necessarily a man in the confines of I am talking to my wife, because the honest truth is that unmarried people are engaging in sexual activities. So how comfortable are men or young boys, are they oriented to think they also have a role to play? Because the truth is that because men don't get pregnant, it absolves them of taking whole responsibilities from it, because they don't physically bear the impact of the consequences of engaging in unsafe sexual activities. So what are you educating men to do? Are you teaching them that barrier method is a must by the time you have, if you begin to have sexual relationship outside of marriage? And even in marriage, do you talk about how you can limit your family size? And do you take an active role? You know, to give men their flowers, there are men that are the ones that take their wives to contracts. As a gynecologist, I've seen men bring their wives. The wives are not even ready, but the husbands are ready. They're the ones driving their wives and say, Madam, please look for what works best for this woman. We don't want to have children for now. So it's not like all men are anti-contraceptive options. So the terms that we use is how do we educate boys and men to also know that they carry equal responsibility in protecting themselves, not just even in protecting the women, because some of these methods, especially barrier methods, help to reduce STIs. We also see a lot of men that come with the complications of STIs they had in their youth as adults. If you go to urology clinic, it's everywhere. You see a lot of men that cannot carry the financial burden of the multiple children that they have. So they should also begin to see the reward for them as young men or as adult male if they can limit the rate at which they procreate. And for those in R&D, innovation, research, and development, is to create more methods that are male-centered as opposed to those that are always female-centered. Thank you very much.
Thank you very much. Let's give it up to her. Thank you so very much on this. Yeah, very much on point. So I think, okay, we have more conversation in the room. It's good to have. It is going off and on, and it's the only one available.
Good afternoon, everyone. I am Dev. I'm talking from an experience. This program is a very wonderful program. The question I want to ask is, the question goes to the panelists concerning the discussion that we just finished. For example, you were talking of technology and how to improve family planning and some other stuff like that. Some of us that are persons living with disabilities, people take a lot of advantage on us. And then thank God we are here to discuss things that has to do with family planning. It is important to have access. And then what are your plans for inclusivity of persons living with disabilities in this?
Absolutely. Thank you so very much. Very good. Very good. What's the sign language for very good? Okay, you have said it. But I think thank you very much for bringing that up. Issues of inclusivity is also something we need to look at. And this brings us to the point I made earlier on that every intervention should think about the target audience. This audience aggregation is something that will keep advancing the conversation, but I think it's important to bring everyone on board as early as possible. Okay, so much said for now. I will leave my story to the end of my own family planning story. I'm sure you'll be glad to hear it. So his question, yes, he has asked about what is our plan for inclusivity. Okay. How sensitive is it to the a very, very great question. So our panelists, would you want to, even the finalists, in case you also have an answer to this, likewise, our panelists will be able to take just 1 minute each, but let's start with the director first. Over to you, sir.
Okay, thank you. Everyone that has raised issues, from the earlier issue raised on religious leaders' involvement to male involvement and then the rights issue. I want to just provide brief clarifications. The religious community leaders have always been part of the National Family Planning Program effort at demand generation, awareness creation, because they are the gatekeepers within our communities, within these various segments of the societies. A lot has been done. Specifically, we have this interfaith forum that meets once in 6 months. And then every 2 years, we have a big meeting that involves religious and community leaders drawn from across the country, because we believe that what they say is easily taken and believed by the community members. So we have a very key place for them in the National Family Planning Program, and they've been doing a lot. So they are not left behind. We have a big forum through which we interact with them and go back to the communities, sensitize their members, encourage them, let them know the benefit of family planning to the women, to children, to families, and to a large extent, the communities and the society at large. So we are carrying everybody along. In the same vein, we are carrying men along. One of the key strategies in family planning is male involvement. Whether they are married or not, they are supposed to be part of the family planning program, giving messages positively about family planning. And then where they are married, to encourage members of their wives and adult members of their families to take up contraception to meet their needs and not be a hindrance. We know that culturally there are places that the men have to give consent for women to access health services in general and family planning specifically. So we encourage them to always understand when health services should be sought, including family planning, and we've been getting positive results along these lines. So male involvement is important, and we've been also encouraging men to use the condoms, male condom, female condom work with their spouses to ensure that the female condoms are properly and correctly inserted. And for vasectomy that Dr. Umeh mentioned, men also are being encouraged to do that. But you find out that it's the women that are not allowing their men to do vasectomy. So the women will rather, most women will rather want to bear the burden. So women, please join us in encouraging men to do vasectomy. Then finally, on the issue of those with disabilities, family planning is hinged on human rights. It's part of human rights. So we want everybody to be involved. And when I was speaking earlier, I talked about Nigerians of reproductive age. I didn't say women, I said Nigerians, which means it's both men and women, and those that have any form of disability. Actually, our vision for Nigeria's family planning program is to have a Nigeria where everyone, including women, girls, populations with challenges or issues, are supported to access family planning by on or before the year 2030. So we are promoting inclusivity. Nobody should be left behind. And that's why we have about 13 different products in the family planning method mix, so that when you are counseled, when you are given the information, you have a broad range of methods to choose from, irrespective of your status in society. So everybody's included, and the family planning space is wide enough. All you need to do is to see where there's the green dots, the family planning logo. Anywhere you see that, you know that family planning services are provided, and you go in there, you'll be counseled, and then the appropriate one you have chosen will be provided. Thank you very much.
Thank you very much, sir, for shedding light on this. And I believe the message is well communicated. Let's get more remarks.
Good afternoon, everyone. I just want to respond to what Oga just said. Oga, I have 9 children, and that 9 is back to back. The first, the first set, they are twins. And maybe it's a disorder in my body, I don't know. But each time I am pregnant, in fact, when I'm pregnant, I won't know until I get to 5 months, because my period will be normal. The normal 5 days and what have you. I remember when once I was pregnant and I had a baby that was 4 months old. And the doctor said it is medically impossible to be pregnant as long as you are breastfeeding. And I was breastfeeding. By the time I now went to do the test, it showed that I was pregnant. So over time, the only way I know that I'm pregnant is I would have serious low abdominal pain. And by the time I go to the hospital, they will say I have ovarian cyst. Over time, the ovarian cyst will disappear. That's the only way I know. I've never done the ovarian cyst surgery, because they will say, don't lift heavy things, don't shout, and the rest. And it will go. And if it doesn't go, then they will do surgery. It got to a point I had to tell my husband that, as it is, don't you think you should do this vasectomy? Because since my body get problem with you, he said, no, that since my own has problem, it's my womb they should remove. So, so I think it's high time, even the men, just as you educate women, even the men should be educated on the importance or the usefulness of that vasectomy.
All right, very important. Permit me to ask, have you stopped? Okay, it's possible that, so whatever solution works that puts it, that you're able to, anyway. So, but I think these are critical questions and issues that go beyond this room, that the stakeholders need to also help us have a closer look at to ensure we have a balance in this conversation. 2 hours definitely is not enough to conclude this conversation. It's an ongoing discussion, but it's good that we have made good progress today. Let's put our hands together for ourselves. It's been a very warm section. So far, so good. Not sure. Or is there anyone who still wants to say something? No, because of our time. Oh, okay. The last one. Can you project? I should bring the mic. It's really, I really must commend that. I didn't like the idea of using one mic in this event. It doesn't speak well. So technical team, please let this not repeat itself. You don't have to keep walking around the room with just one mic.
Good day, everyone. Good day, everyone. My name is Aisha. Everyone has practically said what I wanted to say, but then no one, I think my observation or talk would be to the person that proposed the Ilikita, I guess, from the north. I'm a medical student of Bayero University, Kano, and when I was doing my internship at Nasarawa Hospital, Kano, we got to see some women that came there. I think one of my intervention with one woman, she said her husband, she was pregnant actually. And when we tried to ask her, she said she's booking for a CS. Why CS? She said, Megida Mubayaso. Our husband doesn't like vagina births. So we tried to engage her further, and then she said, she and her co-wife, their husband said if they should give birth via vagina, the vagina will laugh and all that. So reasons like that. We have women like, I think I had, my research was on pain tolerance and pain threshold on pregnant women, primigravida pregnant women. So, and then I get to see a woman that, she said 18. Yes, you had me right, 18. We tried to ask her again, are you not doing family planning? She said, how can she stop what God actually, when God gives her the children, how can she stop that? And then this boils down, it seems that sometimes these women actually want to do this family planning, but then the husbands doesn't want. But then we kept on talking about family planning, how to involve the men and all that. But how do you involve men that don't know what is family planning? You involve these men and they don't know what is family planning. So basically, I don't know if the Ilikita goes down to the north, or if there's any program that will go down to the north in discussing this family planning and sensitizing them. I think it will go a long way, because down that area, we get to see a family, one woman giving birth to 18 children. Here, I don't think we have a major problem about that, but over there, we have a major problem there. Thank you.
Okay, you see what we're saying, that there are contexts to this conversation, and we need to also look at where the burden of the challenge is more prominent. Director, I don't know, there's a lot of interest in this conversation. People are raising more hands, but we don't have much time. Yeah, so we've been told to move on. Apologies. Let's believe that we'll have more opportunities subsequently to advance this conversation. But the point is made, and the stakeholders have taken notes, and I believe we will make more progress moving forward. So it's left for us to have the platform that will be launched and presented to us now, and that is the Family Planning Innovation Platform. And to speak to us and make the formal presentation is no other person than the FPIRHCS specialist representing UNFPA. Ladies and gentlemen, please let's make welcome Dr. Joaquin Chijide. A round of applause for Dr. Joaquin, please.
Thank you so much. So I have a very simple task. My task is to share with you the innovation platform. Can we have the media beam the website to us? All right, so while we're waiting for the media, I think it's important for us to quickly acknowledge the teams that have come forth to present both the innovation and also the hackathon. Shall we have Contratech, Project Planwise, MedBot Family Doctor rise. Let's give them a round of applause. All right, thank you so much. You may be seated. Let's also have Kiakia, Ilikita, and Parker's Mobile rise as well. Let's acknowledge them. All right, thank you so much. You may be seated. So all these beautiful innovations and hackathon outcomes have been placed on the website. And this is important for us because what we need to do is to be able to go to that platform and see these wonderful presentations in greater detail. The other thing to mention is that I think it's important also to have that repository where we can have all of these innovations, not just stored for our use, but also for us to know that this platform will be up so that other innovations can also be accommodated. And I hope those innovations will provide an opportunity for us to also begin to address some of the concerns raised today around ensuring that men are included, ensuring that the religious institutions, traditional institutions are well involved, and also that persons with disability are not left behind. So this is what the platform looks like. The platform, the URL is psc for fp.ng/innovation. So it's really private sector engagement for family planning.nigeria/innovation. So we can all go to that platform and interact with those with the innovations in greater detail. I would like the media to please click on Parker's Mobile Clinic, the section that says read more. All right, so when that loads up, I believe there are some videos you can see and interact. Okay, I'm not quite sure it's Parker's, but you get the drift. There are some media messages there where you can get more information in greater detail on that. So before I yield the floor, just to say that for me, today has been quite exciting. Okay, many of the innovations have tried to do a couple of things. Some of them have tried to address the issue of leaving no one behind, okay, which is a cardinal principle for us as the United Nations. Some have addressed some critical barriers to access. Others have talked about promoting sustainability. I think it was very apt that many of the presentations actually gave us an idea as to how they would finance these innovations going forward, and also give us an idea as to what support they would require. The issues of improving access, enhancing efficiency, and also improving accountability were also addressed by many of the presenters. Let me once again thank them and thank the organizers for this. Thank you, and thank you for your attention.
Thank you very much. Thank you very much. Thank you very much, the representative of UNFPA, for that great section. All right, so we are now at the climax of this event, and it is now to announce the winners. This is one part that brings a lot of interest. So we first want to invite all the, I think we may have to move. Can someone help us with this rostrum so that we can move it to the side? Because we're going to have everybody on stage. So we're starting by inviting the first set, which is the hackathon finalist presentation. And I really like doing this kind of role when you are the only one who has the name of the winner in the room. The rest, everybody is on suspense. So let's welcome all the hackathon finalists. First, we'll be having no particular order. Let's just come up. Contratech, Project Planwise, MedBot Family Doctor. Please let's welcome them to the high table. A round of applause. And to make the presentation of the prize for this group is no other person than our very distinguished director from the Ministry of Health and Social Welfare, Mr. Hanyawo. Let's welcome Mr. Hanyawo to the high table. All right. So we have the 3 finalists on the stage. And let me announce again that the prize for the overall winner is 1.6 million naira. However, there will be consolation prize for second and third. When I was told the consolation prize, I told my Oga that told me, I said, this one is like winner takes it all. The consolation prize is 100,000 naira. But it's something. It's actually meant to have been winner takes it all. But at least, technically, they have something to encourage for their efforts in this regard. Ladies and gentlemen, we will be using a dummy check, which director will present to the overall winner after I announce. Then they will have the photograph and they will step aside. They're not going down immediately. So the overall winner of 2023 Family Planning Hackathon competition is Contractor. A round of applause for Contractor.
To be the best, number one and nothing less. Lead me to my destiny. I have waited patiently. I have vision, though I believe. I know I can count on. So stand up for the champion, for the champion. Stand up, stand up, stand up.
So, thank you. So, ladies and gentlemen, join me in congratulating the winner of this hackathon competition, Contratech. And on behalf of the, congratulations, first of all, on behalf of the Honorable Coordinating Minister of Health and Social Welfare, I present to you and your organization this check of 1.6 million naira for emerging winner of this competition, which was keenly contested for. And I know that the money might not be that much, but it's just to encourage you and your colleagues who might not be here to do a lot more. So ensure that you put it to good use in researching more so that you will continue winning any competition you take part in. Congratulations once more.
Thank you very much. It's also important. Congratulations. Just stay by the side. Everybody, just stay by the side. It's important to mention that all finalists will be getting mentoring from experts, which includes Microsoft. Another round of applause for these organizers. Congratulations. So for the consolation prizes, you will be reaching out to the organizers at the end. Great job, guys. Congratulations. And now to the second part. Thank you, Director. Please also help us stand by. The second part, which is speaking out to the innovation, we had a panelist presentation and we had 3 innovators who made their presentations. So in no particular order again, let's welcome to the podium, E-Likita. A round of applause. Where is E-Likita? Then we have Parker Mobile Clinic. Parker Mobile Clinic, is it still around? Doc, let's have you up. And we have Care Health. A round of applause for them as they make their way to the podium. And to present for this section of awards, the prize is 1 million naira. So this, as the director said earlier on, is to encourage them to do the work they are doing better. We believe that there will still be opportunity for more fundings. Please let's welcome to present this award, the representative from UNFPA, Dr. Joachim. A round of applause for Dr. Joachim, please. Thank you so very much. So please move. Look, Dr. Joachim, just stay there before we unfold beside the director. Yeah, before we unfold the winner. Ladies and gentlemen, the winner for 2023 Family Planning Innovation is
number one.
And he's
Destiny. I have waited patiently. I have been.
Congratulations. Thank you. Congratulations.
Can count.
Congratulations.
For the champions.
Or do you want your other colleagues to join you? Is that allowed?
Stand up. Stand
Congratulations.
Up.
Hold on for the presentation now. Thank you very much.
All right, permit me to congratulate Kiakia Health for winning the Family Planning Innovation Spotlight for 2023. Again, I say it's 1 million naira, and we believe that you put it to good use. Congratulations.
All right, ideally we're supposed to allow them to say a word or two, or if they don't want, it's fine. Anybody want to say a word or two for the winners? Oh, you're fine. They're fine. Congratulations is in order. A round of applause for everyone. Please don't go, don't go. Now we're going to have group photograph with everybody. Please show your prizes. And let's have all those who give goodwill message to join them, please. Please, Pharmacist Ugochukwu, Rhoda Robinson, and all other colleagues who gave the remarks earlier on. Please join them for the photograph. Yeah, keep it up, keep it up.
For the champions, for the champions.
Pharmacist Ugochukwu, please join them, sir. The representative of USAID, please join them.
And when I
MSI, DKT, please join them.
to pick myself back up.
Okay, fine, you can be in the middle.
Down. I have to pick myself back up. And when I fall down, I have to pick myself back up. And when I fall down, I have to pick myself up. Stand up.
Stand up for the champion. Congratulations. Congratulations, everyone. Let's give it up. Let's give it up for them.
For the champions.
Let's give it up.
Stand up. Stand up. Stand up. For the champions.
All right. From Pharmacist Ugochukwu, please, before you go back, please, you'll be taking the next item. All right, thank you very much, everyone. So we are bringing this to a close gradually, and to formally give the vote of thanks on behalf of the ministry, it's no other person than Pharmacist Ugochukwu. A round of applause for him, please.
Good afternoon, ladies and gentlemen. Good afternoon, ladies and gentlemen. Okay. So let me hope that I'm talking to people. Thank you very much for being here. Only that the MC is like I've been marginalized because all the time you were talking here, you have, what do I call it? The rostrum, you have it. And now you're asking me to talk just being naked. Okay, no problem, no problem. Thank you, everyone. The program, of course, everyone that are in this place, that this particular program is very, very impactful. is full of information. Whatever is very short, but what has given us today is much. Because anything you think about concerning family planning is more or less has been spoken in this place. And I want to appreciate the innovators and the, what is it called? The hackathon. Appreciate all of you. But one of you were talking about taking services down to the household. And when the person was saying it, what goes into my mind was those days when I was in Lagos. And you know, some of you that are in Lagos, you know what happened in Lagos. Especially, I'm not talking about VI or I'm talking about Bariga. Yeah? Because when I was in Lagos, I stayed in Bariga. Abi Akoka towards Bariga. And what happens there is that any day I don't go to work, I'll just come out of the gate, sit by the gate. You will eat everything you want to eat. That's Ewa, at Brady, Ewa, at Dodo. All sort of food. You sit at the gate of your house and eat everyone. What am I trying to say? That the innovation coming to health. I thank that particular group that said it. Probably very soon you'll be whatever you want as regard to health. Can we have a hand of applause too? But that does not mean, because I'm not trying to take side, but that's what stick to my mind when you were saying it. I appreciate every other one that have come out here to talk and to give us the new innovation that we are following. And thank God that when you go through the website this afternoon, you all see what you read and then assimilate, and you can talk to people concerning family planning. Thank you, everyone. I want to appreciate UNFPA that made this gathering to come to reality. But I know without further, UNFPA cannot do this. And in that case, I want to appreciate my boss, who is the Minister of the Federal Republic of Nigeria, Minister of Health and Social Welfare, and also my director here present that represented the minister, and every other directors from Federal Ministry of Health and other agencies. I appreciate you. I also appreciate other partners. I wouldn't want to mention names because one and I didn't call the other is a big bridge. So I want to appreciate every partner that are present here. You've done well, because without you, I don't think government alone can move family planning program forward. Thank you very much for being here for us. And also the private sectors. Healthy, I don't know how to say thank you, but I know you are doing your job and you are doing it very well. You are doing it very well. Let me stop there. We'll talk in camera. There are other partners that are here, other private sectors. I've seen some CPs, and most likely, I know PPMVs might be here too. But nevertheless, all the private sectors that are here, I give you kudos for being here. And I won't fail to mention the media. Thank you for being here for us. Then finally, the MC, I think what I want to tell is that maybe I want to be like you when I grow. You've done so well. Thank you very much. Ladies and gentlemen, on behalf of my honorable minister and the director, which is my boss here present, I want to say thank you to all of you for coming. Thank you for gracing this occasion. Thank you for impacting every other person that are here. And thank you for giving us what we are taking home with. Thank you, and God bless everyone.
Let's keep it up. Let's keep it up until he gets back to his seats. Thank you very much, sir, for finally giving us the closing remarks on this from Sister Gochiku. And thank you for your kind words. So we're gradually now wrapping this up finally, but with just a few announcements. I've been asked to let us understand that the first steps in the hierarchy of behavior change is awareness. So for us to be able to continue the conversation around family planning, we encourage every one of us to please, when you step out, make sure you take pictures with your props. Please take pictures and share. I see a lot of young people in the room. Please share on your platforms, Instagram, Twitter, wherever you can share. Please share it. And the hashtag to use, apologies to the 17th century generation, they may not know our hashtags. So the hashtag to use is FP Innovation 23. Hashtag FP Innovation 23. Please endeavor to do this. It's very important as part of the awareness and to register that you have been here. Yeah, it calls for saying. We will be having lunch, and as we close on your way out at the restaurant, which is close to the reception, you will be guided. The ticket, which is like your boarding pass, will be handed over to you to grant you access to the dining room. As we close today, I leave you with my own story in 1 minute. My first child and the second are 3 years in between, a boy and a girl. And both of us agreed, my wife and I agreed, that was all. 7 years after, as in 7 years after, the two kids came together and said, Daddy, Mommy, we need a younger one. So we thought it was a joke. They turned it to prayer points. When they are praying in church, they will ask Mommy, go out and pray for fruit of the womb. So we still thought it was jokes. Somehow, their prayers got answered. So as soon as my wife got pregnant, I said, wait, in case, now the boy said they wanted another boy or a girl, anyone. So I said, in case they will come back again, because it's actually going to be one gender that will come. In case the boy will come and say it is girl that they want after that, let's look for a final solution to this. So we did BTL. So bilateral tubal ligation put an end to that. Doc, I hope that one is acceptable. Or you're not okay with that one, at least. So I'm part of the proponents. Okay, we should not discuss that. Of that. And with this, no matter what they pray now, it must really be a real miracle for something else to really happen. Your Excellency is very distinguished, ladies and gentlemen. It's been an exciting moment here with everyone today. A very interesting conversation. Let's put our hands together for ourselves as we bring the meeting, the Family Planning Innovation Spotlight 2023 to a close. A round of applause again for ourselves. Thank you so very much. May we please rise for the national anthem. Congratulations. Thank you very much. Thank you, organizers, for the opportunity for being your anchor on this event. Thank you, everyone. God bless you and see you again. Lunch is served. Bon appetit.
Don't know we're in a population crisis. 75% of our population is under the age of 35.
Family planning is an integral part of that equation.
Family planning demand is growing beyond what government can take care of.
The country is projected to double her current population by 2050.
This is sort of a systemic issue. If you think it's religion that's preventing us, the government right says maybe not true.
Innovations in contraceptives have provided more choices and greater autonomy to women. Lagos State has made commendable efforts in improving family planning services.
We need to acknowledge that Nigeria cannot continue to provide free services to everybody.
The more people are healthy, the more they are empowered, the more couples are able to plan their family, the more they will work and make more money.